Have you noticed your urine looking darker than usual? Sometimes the reason is simple, but sometimes a persistent change in urine color can be worth paying attention to. Dark urine doesn't automatically mean your kidneys are failing. Dehydration, certain foods, vitamins, medications, and some health conditions can all change urine color. The key is knowing what else is happening. Today we'll look at 7 possible reasons for darker urine and the changes that may deserve a conversation with a healthcare professional. First, let's look at the most common reason urine becomes darker, something that can often be corrected with better hydration. The most common reason for darker yellow urine is often dehydration. When you don't take in enough fluid, your urine becomes more concentrated, which can make its color appear darker. You may notice this more after sweating, exercising, spending time in hot weather, or simply going for long periods without drinking enough fluids. Darker urine from dehydration may become lighter as you rehydrate. But don't force yourself to drink excessive amounts of water just to make your urine clear. Your fluid needs can vary depending on your health, activity, medications, and other factors. If you're consistently thirsty or your urine stays unusually dark despite normal hydration, it's worth discussing with a healthcare professional. But dehydration is only one possibility. What you eat or take every day can also change the color of your urine. What you eat or take as a supplement can sometimes change the color of your urine. Certain foods, vitamins, and supplements can make urine look noticeably darker, brighter, or more unusual. For example, some B vitamins can make urine appear much brighter yellow, while certain foods and supplements may change its color in other ways. These changes don't necessarily mean your kidneys are being damaged. If your urine color changed soon after starting a new supplement, medication, or dietary product, take note of the timing and mention it to your healthcare professional if you're concerned. Don't stop a prescribed medicine without professional advice. But if darker urine comes with pain or a burning sensation, that's a different clue, and one you shouldn't simply ignore. A urinary tract infection can sometimes change the appearance or color of your urine. You may also notice that the urine looks cloudy, darker, or has a stronger than usual odor. Burning or pain when you urinate, needing to go frequently, or feeling an urgent need to urinate can also occur with a urinary infection. These symptoms aren't specific to kidney disease, but they shouldn't be ignored if they persist. If dark or cloudy urine is accompanied by fever, back or side pain, vomiting, or feeling significantly unwell, seek medical advice promptly. A healthcare professional may need to check your urine and determine whether an infection or another condition is responsible. But sometimes darker urine isn't coming from the urinary tract at all. It can be related to what's happening in the body's muscles. There's another, less common reason urine can become unusually dark: severe muscle breakdown. When muscle tissue is damaged, a protein called myoglobin can be released into the bloodstream and eventually make the urine look dark brown or cola-colored. This can happen after extreme or unfamiliar exercise, major muscle injury, prolonged immobilization, or certain medical conditions. The urine may become much darker than ordinary dehydration-related yellow urine. If your urine suddenly becomes brown or cola-colored after intense exercise or muscle injury, especially with severe muscle pain, weakness, or swelling, seek medical care promptly. This is different from simply having slightly darker yellow urine from being dehydrated. But not every dark color comes from dehydration or muscle damage. Some medicines can change urine color too. Certain medications can also change the color of your urine. Depending on the medicine, urine may appear darker, orange, reddish, or another unusual color. A medication-related color change doesn't necessarily mean your kidneys are being damaged. The timing can be a useful clue, especially if the change started soon after beginning a new medicine. If you're concerned about a sudden urine color change after starting a medication, check the medicine's information and speak with a healthcare professional or pharmacist. Don't stop a prescribed medication on your own. But there's one urine color change that deserves special attention, especially when it appears with other symptoms. Sometimes urine can look pink, red, or brown because blood is present in it. Even a small amount of blood may change the appearance, although blood in urine isn't always visible to the naked eye. Blood in the urine can have several possible causes, including urinary infections, kidney stones, prostate problems, certain medications, or other conditions affecting the urinary tract. It isn't something you can safely diagnose from urine color alone. If your urine appears red, pink, or brown without an obvious harmless explanation, especially if the change keeps happening or comes with pain, fever, or difficulty urinating, contact a healthcare professional for evaluation. And there's one final possibility that can make urine look much darker, especially when other symptoms appear at the same time. Another possible reason for unusually dark urine is a problem involving the liver or bile system. When bilirubin builds up in the body, some of it can pass into the urine and make it appear darker, sometimes brown or tea-colored. Dark urine from bilirubin may occur alongside other changes, such as yellowing of the skin or eyes, unusually pale stools, itching, nausea, or abdominal discomfort. These symptoms can have several possible causes and need proper evaluation. If dark urine continues despite normal hydration or appears together with yellow skin or eyes, significant abdominal pain, fever, vomiting, or feeling seriously unwell, contact a healthcare professional promptly. The color alone cannot tell you the exact cause. So, darker urine can have many explanations, and the color alone usually isn't enough to tell you which one is responsible. So, darker urine doesn't automatically mean something is wrong with your kidneys. Dehydration is common, but foods, vitamins, medications, infections, muscle injury, blood in the urine, and liver-related problems can also change urine color. Pay attention to whether the change is temporary or persistent, and notice whether other symptoms appear at the same time. If your urine stays unusually dark despite normal hydration, or you notice red, pink, brown, or tea-colored urine without an obvious explanation, it's worth getting medical advice. And remember, urine color alone cannot diagnose kidney disease or any other condition. A healthcare professional may use your symptoms, medical history, medications, urine testing, and blood tests to work out what may be happening. If this video helped you understand what darker urine can mean, give it a like and subscribe to VitalBites. This is week 1, day 7 of our 90-day healthy aging series. Next day, we'll move deeper into the kidney tests and numbers that can reveal what your kidneys are actually doing. This video is for educational purposes only and is not intended to diagnose or treat any medical condition. If you have persistent or concerning changes in your urine, please consult a qualified healthcare professional.